Hi, it's Stephanie. I'm with the Quality Department at Russell Medical, and today I'm going to be teaching you how to use teach-back education with your patients and why it's important. Alright, so today we're talking about teach-back education. I wanted to put a couple of funny things here to start with. We've all been there. You've got 2 discharges waiting to go, 2 admissions waiting to come in, and you've got your packet printed and it's thick because they've got heart failure, diabetes. You rush through the medications and follow-up appointment, touch on the high notes, and then say, do you have any questions? Okay, sign here please. Clearly this man does not understand his health condition. I just wanted to start with some funnies just to break the ice. But all jokes aside, teach-back is a method that we can use with our patients to ensure understanding. It is an indication of how well you communicated the information to the patient. I know if it were my mother in the bed, our transition back home would go much smoother if she thoroughly understood the information that was given to her at discharge. So why teach-back? Limited health literacy in our area is real, and it leads to medical errors, increased healthcare costs, inadequate knowledge of care for chronic health conditions. Most research shows that patients only remember about half of what the doctor tells them or the nurse tells them at discharge. Nearly half of all Americans have difficulty understanding and using health information, and using teach-back helps determine what needs to be clarified for the patient. Discharge education has been identified in several patients as a possible reason for readmission by our readmission project. Not all readmissions are preventable, but if we can use teach-back to help reduce the likelihood, we should. I hope this slide helps bring the issue closer to home for us. One of the questions on our HCAPs is, when I left the hospital, I had a good understanding of the things I was responsible for in managing my health. These are the current scores for last year. The benchmark is what we need to be at the top 10% of hospitals. It seems a little sad that the top 10% of hospitals is only 63%, so there's lots of room for improvement when it comes to patient education. And if you've looked at the HCAP scores on the units, you'll see that there are several questions related to discharge education, not just this one. And by the way, HCAPS affects our payment from Medicare, which in turn affects us, how much money the hospital has coming in. There are also several insurance companies that are reviewing patient education when it comes to readmissions to the hospital, even denying payment for the entire stay because there's not enough evidence that we did our job to make sure that the patient understood what to do when they discharged from the hospital and went back home. So the big idea is to help develop confidence and skills in our patients, not just transfer the information over to them, but help them to take ownership for their health. We have the power to improve retention of disease-specific knowledge in our patients. So teach-back basically is just asking the patient to explain in their own words what they need to know or need to do. You want to make sure you're explaining to the patient that you want to know that you communicated the information well, that it's not a test of their knowledge. We want to use open-ended questions, and most importantly, to document the use of the patient response to the teach-back, because if we didn't document it, then it didn't happen. We want to use phrases such as, I want to make sure I'm explaining this correctly. Can you tell me in your own words? Or ask, what will you let your husband know about the changes we made to your blood pressure medication today? Or even, can you tell me 2 side effects we'll be watching for with this medicine? This is what teach-back is. We explain the information, ask specific questions to assess, clarify if there's any miscommunications, reassess, and all this leads to a better understanding by the patient. So we really want to activate our patients, and that is giving feasible behaviors so that they can experience success. We want to motivate them, increase their knowledge, and that results in that skills and confidence that we're trying to teach them about their conditions. And higher activated patients have better outcomes. And we want to make sure that our patients understand that they are responsible for taking care of their health. They must take an active role in their health care. So this slide kind of shows the difference between low activation patients and high activation patients. A low activation patient may not acknowledge their diagnosis. They say, people will tell me I have heart failure, whereas a high activation patient accepts their diagnosis and the process of how they manage it. A low activation patient thinks taking medications will manage their illness alone, whereas being highly activated understands the collaboration of medicines, diet, exercise, and social support are all necessary for management. And finally, low activation patients feel that the doctor will fix whatever's wrong with them, whereas high activation patients take ownership of their health care and they know that they are responsible for taking care of themselves. So currently we use a fill the pail model. It's where we fill the patient up with all the information they need, and that's dumping way too much knowledge on them all at once, right at discharge when they're already ready to go. We use a take a deep breath, spill it all out, any questions, sign here method. Remember, patients only remember half of what they hear on average. This is why it's important to spread the information throughout the hospital stay, but more importantly, to light the fire for the patient, to know they want to do better, to understand their disease, and how and when to ask questions. We have to meet those individuals where they are, build their skills and confidence, and support individuals to take ownership of their health. Most importantly is keep it simple. We have a very low health literacy in our area, meaning that patients don't really understand what is involved with their health care and what things that they need to do to manage their own health. So we have to keep the teaching that we do to our patients very simple. 3 questions we want every patient to be able to answer when they leave our hospital is, what is my main problem? What do I need to do? And why is it important for me to do this? In order to answer these questions by discharge, this occurs throughout the hospital stay. As you administer medications, talk about the purpose and side effects of each one. As you weigh a patient, explain the importance. During meal times, explain why they're on a diabetic diet. Use a teach-back method during all of this. Ask the patient, can you tell me what you take Plavix for? Or, how much weight can you gain before we need to call the doctor? Or, between these 2 foods, which will help you control your blood pressure the best? Make sure the patient knows not only what to do, but why they are doing it. First of all, we want to make sure that they have a comfortable environment. In one of our readmission analysis, I found that a son was taking care of his elderly mother who was forgetful, and the discharge instructions were discussed with the patient before the son arrived to pick her up, so he never received education on how to manage her disease process at home. So when she started having problems again, he just brought her straight to the ER. Make sure your patient is comfortable, attentive, and engaged during instructions. Turn the TV off. Make sure they're not in too much pain or too sleepy to understand. And include the family members or caregivers. We want to be clear in our communication. Use plain, non-medical knowledge. Note what words they use to describe their illness and use those in your conversation. Slow down, speak clearly, limit the content to 3 to 5 key points. We don't want to dump too much information on them at one time. Use short statements and then check for understanding by using teachback. So this is really where it gets to the meat of what we're going to be doing different in Meditech. We want to make sure we're covering all 5 topics: diagnosis, medication and side effects, warning signs, actions or who to call, and the importance of attending follow-up appointment. And we came up with an acronym to help remember all 5 of these topics. Discharge me with all information. And as long as you cover all 5 of these topics, it will cover all of those HCAP questions, and it will help our patients to really understand what they're responsible for when they leave us. So now we're going to look at the Meditech screens to see what's going to be different in the nursing documentation. Each day when you're under the care plan review intervention, the number 4 problem is knowledge deficit. And we have put all 5 of those topics from the last slide underneath knowledge deficit. Under each topic, you'll specify what you're going to talk about. Such as diagnosis, the specific topic is going to be congestive heart failure. Underneath each specified topic, there is a goal, and I have come up with some cheat sheets for goals for you guys that'll be on the units. I'll talk about that later. Underneath the goal, there is the Teach Back Education box, and what you're going to do is first type the date and then a short little sentence of what you've done related to that topic, and then your initials at the end. And Meditech is still going to track the time that you document, as well as the who documented, but this just makes it a lot easier for the next nurse to follow what you've done and know exactly where to pick up and where the patient's understanding was the day before. And then there's goal status will still be on there for med or progressing. This slide is a continuation of those 5 topics: the warning signs and actions of who to call. And then finally, the importance of your follow-up visit. And then we included another section titled Other, where we can put anything else that the patient needs to know. On this example, I did their diet since it was related to heart failure. Now, at the end of their stay, the 5 topics as well as their goals will print out on their discharge instructions, and it will look like this. The patient then has a chance to look at what our goals were, make sure that they understand what they need to know, and it gives us an example to reassess that information and give a quick explanation for anything that they don't understand. This does not leave all the teaching on the discharge nurse, whereas right now that's kind of how we do things. This spreads the education throughout the entire stay, and then we're just reassessing what we've already done at discharge. So it's a lot quicker for the discharge nurse to finish her education. So there's several resources focused on TeachBack. There's teachbacktraining.org. They have a TeachBack learning module on there. Additional resources, our EBSCO Nursing Resource Center also has several articles about TeachBack and why it's important. Case management, we're a resource for that education. We can take care of medical equipment needs that the patient has, or different referrals for home health, palliative care, things like that, to make sure the education continues as the patient goes home. You want to make sure you're being creative with your TeachBack. Some patients will understand things differently. There's so many ways to educate someone. Some studies show music helps us remember, using a chart for medication education, drawing a picture of what you're trying to explain to a patient, or coming up with a catchy jingle are great ways to help patients truly understand what you're trying to teach them. The good part is we have several diagnoses that are the same for each patient. We just have to customize how we educate those patients depending on what their specific needs are. We want to try to give examples to the patients. Like, if you start wheezing tonight after you get home, what are you going to do? To help them think through the process of what medications that they have and what the purpose for them are before they come back to the ER when they already have 2 inhalers and 2 different breathing treatments at home and they've never even tried them. So I'm going to show you a little quick 3-minute video on YouTube of example of TeachBack education.
All right, Chris, so you came in today for an urgent care visit because you're feeling more short of air. And after examining you and looking at everything, we feel like the shortness of air is probably because your heart failure is a little bit worse. Today is Monday. Our plan is to help with the shortness of air and to help with your heart failure. I want you to double one of your medications. So you told me that you've been taking Lasix 20 milligrams every day. I want you to start taking 40 milligrams a day. So you're going to take 2 tablets every day. And then you're going to take that every day for the rest of this week. And I want you to come back on Friday and see me again. The reason that I'm doubling the Lasix is because the Lasix helps pull the fluid out of your body. I think the fluid is what's making you feel short of air, and the Lasix will make you pee more frequently. And I think that will help with the shortness of air. Now you are pretty short of air. Your weight is up a lot, and so you are sick. I am concerned that if things get worse, you might need to get admitted to the hospital. So if you start having chest pain, worsening shortness of air, or if your weight goes up, I want you to either give us a call or come to the emergency room because I want to know that that's going on. Okay? So I just threw a whole bunch of information at you. Can you explain back to me what the plan is and what we're going to do this week for your shortness of air?
So, because I've been having more trouble breathing, you think it's because of my heart, and so we're gonna double one of the medications I'm already taking.
Yep.
And if it makes me start needing to go to the bathroom more, I'm supposed to go to the emergency room and then call you guys.
So actually, we expect the medication to make you pee more. So that's how it works. That's how it gets the fluid out of your body. So we want it to make you pee more. But if you start feeling worse, if you get shortness of air or chest pain, those would be reasons to go to the emergency room. Okay. And I want to make sure that I don't know if I mentioned what the name of the medicine was. So do you know which of your pills it is that you should be taking 2 of?
So I'm supposed to be doubling, taking 2 of my Lasix.
Exactly, perfect.
And it's probably going to make me need to go to the bathroom more. And then if I start to have like chest pains or like it hurts here, or if I'm the breathing, if my shortness of breath gets worse, then I'm supposed to go to the emergency room.
Exactly.
And then I'm supposed to come see you on Friday.
Right.
Okay.
And we'll check up and see how everything's doing. What other questions do you have?
I think that's it. Are you guys gonna give me like this information?
Yeah, I'll give you some patient education about heart failure and things to look for, and put it with your DPART information.
Okay.
All right. Well, it's good seeing you today. I'll see you again. All right. Thanks.
So Tyler, my son, is known as our little elephant because he never forgets anything that you tell him. So this gave me an idea for our Teach Back Education project. I have these little elephants that we're going to put up on the unit. They're going to be on the cows, on the computers, just to help remind us to use Teach Back throughout the day, throughout the entire stay for the patient, so that we can make sure that patient has really gained these skills and confidence in being able to handle their condition at home. By doing this, you have a chance to make a real difference in patients' lives. You're helping them to understand what their disease process is and what they need to do to manage it. And who knows, one day maybe other hospitals will be looking to us to find out how to better their Teach Back education. Thank you guys so much for your time. You really are the heart to this hospital, and you have access to these patients when others don't. I want the entire staff of the hospitals be using Teach Back education with patients, but really we need you guys to document that this is being used, and I'm here for you. If you have any questions or need any help or have any tips that we can use to help each other out, just give me a call. Thank you.